Welcome. I'm Gerry Oginski, a medical malpractice and personal injury trial lawyer practicing law here in the state of New York. Today's topic is birth injuries and something called shoulder dystocia, which results in injury, nerve injury, known as an Erb's palsy or Klumpke's palsy or brachial plexus palsy. Why is this important to know? Well, nerve injuries can occur during the time that the baby is passing through the mother's birth canal and the baby may be too big or the mother's pelvis may be too small. In some instances, you get what's known as a shoulder dystocia. It means that the shoulder gets stuck passing through the birth canal, gets stuck under the pelvic bone. And then what causes injury is oftentimes a doctor who is trying to deliver the baby may not recognize that the baby is stuck and may try and exert forces on the baby's head that cause a stretching or tearing of a group of nerves that run from the neck down into the shoulder. And often when a baby is born with a limp arm, the question is, why is the baby's arm limp? Is it a temporary condition or is it a permanent condition? And time will tell as to whether or not it's a permanent condition, but important, and you must answer this question. Was your delivery a difficult one? Were there instruments used to assist the baby in coming out? Did they use forceps? Did they use a vacuum? Did they have to do maneuvers to try and get the baby out? Was there a sense of urgency in the delivery room? Did they have to do an emergency C-section? Did they call in the most senior doctors to come in and assist to find out what the problem is? Often the first sign of danger is when the doctor performing the delivery will call for help. And that is the correct thing to do when it is recognized that there is a shoulder dystocia. You try and get the most experienced doctor into the room to try and help. And there are a number of things that doctors can do to try and relieve the stuck shoulder from the mother's pelvic bone. And one of the things that is commonly done is using a procedure or maneuver known as McRoberts. And that's by pushing the legs back all the way you can with the knees going up to the chest. Somebody on both sides of the mother is holding the legs, and what this does is allows greater room and greater curvature of the pelvic spine to allow the baby to try and get out. Another common method that's used to try and help the baby out is using what's called suprapubic pressure, where a nurse or another doctor is applying pressure above the pubic bone, but below the baby, toward the lower part of the abdomen, to try and get that shoulder unstuck and let it pass through the birth canal. It is never acceptable to have a nurse or a doctor apply pressure above the baby at the top of the abdomen. That's called fundal pressure. That is never acceptable medical care in order to try and relieve the baby from being stuck and injuring the shoulder and the nerves running from the neck downward. So what else do they do? Doctors have among their arsenal of procedures something called a Woods maneuver or corkscrew maneuver, to try and turn the baby, so to try and get the shoulder out from under the pelvic bone. And they do that without putting any pressure on the baby's head. And what if that doesn't work? There's another maneuver that they call a Rubin maneuver that is just the opposite of corkscrew, to try and get it out the other way. What else is there? Well, another way is delivering something called the posterior arm. It's reaching in, grabbing the arm, and trying to get the baby out that way. Also, another maneuver that's available is for the doctor to cut what's known as an episiotomy, which is cutting the skin between the vagina and the anus to allow greater room so that the baby can pass through. And often an episiotomy is cut in order to prevent unnatural tearing of the skin, which can go down into the soft tissues and into the muscle. And so they intentionally cut it to allow greater room and so that it's a lot easier to sew up afterwards. So there's no permanent long-term damage from that. As a final maneuver, if the baby still is not coming out, the doctor can intentionally break the clavicle, the shoulder bone, in order to shrink the shoulders, to decompress it, to allow the baby to come out. And there's one final drastic maneuver that is known to occur or can occur, and that's something called the Zavanelli maneuver. And it is rarely done, and that involves pushing the baby's head back into the vagina, pushing the baby back up into the birth canal, and then rushing the mother and baby into the operating room and doing an emergency C-section. That is so rare, it is often, most doctors have never even seen it in their career. These are just some of the things that can occur in order to attempt to relieve the stuck shoulder when doing a delivery. And oftentimes, these difficult deliveries occur when the baby is too large, or the mother's pelvis is too small and it goes unrecognized, or when they pull and perform excessive traction on the baby's head in order to get the baby out in a quick and prompt manner. While getting out the baby safely is of paramount importance, it is also important to remember that these maneuvers that I've just described are done without having to put the doctor's hands on the baby's head, because typically and historically, most of the injuries that have occurred to a stuck shoulder have resulted from excessive pulling and excessive traction, causing a tearing or stretching of these particular nerves. And the Erb's palsy is common. It results in a limp arm. It results in an atrophied arm where the muscles are not used and it shrinks down in size. And it's devastating for a baby to go through life as they grow older to have an arm that's simply non-functional and not usable. And over the course of the child's early development, you will see whether or not the child is making improvement. And your pediatrician may recommend that your child be examined by a pediatric neurologist to see whether or not your child is progressing and whether or not the injury that they have suffered to their arm and hand is long-term and permanent. And these are just some of the things that go on in evaluating a potential case involving difficult deliveries, known as shoulder dystocia cases, resulting in Erb's palsy, Klumpke's palsy, and brachial plexus palsy. Thank you for joining me. I'm Gerry Oginski. Have a great day.